Welcome.
Thank you.
Happy Occupational Awareness Month.
Yeah,
I think it's
I
so
appreciate
important.
that.
So we're highlighting the OTs since it's April Occupational Therapy Awareness Month. So, and Deb, how many years have you been with us at Affinity?
Well, with Affinity, I've been with you since the beginning. So is that like 11, 12 years now?
2007.
Yeah. But I've been doing home care for at least 25 years.
25 years. What made you go into the industry?
Well, it's a service need. I have a couple sisters who are nurses, and I just saw and I had a neighbor who was a occupational therapist, and I went on the job with him a couple of times, and just knew that it was a great field, good fit for me.
Occupational therapy is incredibly useful, and that we know that we offer our professional therapists, and in order to receive your services, they require a doctor's prescription. How are you doing with these new guidelines currently right now with the COVID restrictions?
Well, we're all staying healthy, and we all have to do our part. So I just screen myself every morning, and then if in our cases, we have to screen them as well, with their temperature and any coughs or shortness of breath. And then, but the difference is, we always do our hand sanitizing and our washing techniques, but now it's with the mask and, gloves and any other garments that we need to put on. So that's just a little extra, and then some kind of distancing if that's required. But so there's a few changes, but we have to, do what's important. So we're wearing the gloves and the masks. So
the most common conditions that you see that you treat with your patients typically when you're going into the homes?
Yeah, we are OTs treat. We do a lot of orthopedic cases with hips and knees and shoulder replacements or fractures, like if someone has a fall. And we do treat circulatory problems, cardiac patients, pain issues, diabetes, COPD. We work with, congestive heart failures, cancer diagnosis. So it's a huge realm of patients that we can see because, all those diagnoses, they all lead to the changes in your everyday activities. And that's what, occupational therapy specialty is, all your activities of daily living and how they change. So how we can, help you with your new or existing diagnosis.
Mm-hmm. Yeah. And then to the public, ADLs is so important on many levels as an OT. They would also recommend private duty caregiver services because that would be the necessities of the care that you and I could wake up and get dressed, take a shower, remember to take our meds and all that. But typically some of the clients that you have, they struggle with the activities they're living. How does someone begin your services? How, if you had to walk through the public, and how would you begin a new OT case?
If the patient comes probably from the hospital, or sometimes then they go to a rehab, or sometimes it's just a doctor's visit. So that would be where we're getting our cases from. But when and talk to your doctor. Tell them what is going on with you, what changes are happening in your life, and then when we come into the house to see you after we get the doctor's orders, it's we just go through your everyday activities. We see what's changed, what kind of functions were you doing and not doing, that you want to get back to doing again. We'll check range of motion, we check your strength, we check everything from dressing, your mobility, can you get into the bathroom again, in and out of bed, making a simple meal, get into the refrigerator, just your everyday activities we'd walk through with you and your family, because the caregivers are huge. If they're with you 24/7 and we're with you just a couple of hours, it's really important to work with them to get you where you want to be. And that's the other thing we so stress the patient's goals and the family goals. I mean, if my goal is for you to do something that you've never done before, that's that's not the point. It's talking with the patient and the family to get, where do you want to be again, and what is your focus? And that's what we gear all of our next visits on then. Everything that, if you need more strengthening or balance to get in and out of bed, or to get the clothes out of your closet, or to, do the dishes at the sink. It's all those strengthening and balance that we would work on our next several visits.
What if
Yeah,
someone doesn't have a lot of space in their home? How do you approach that? And how much space do you need typically for you to perform your services in the home?
That's the best part. I mean, that's what's so important, is just being in your home, working with the space you have.
Yeah.
We can rearrange or make anything, any area to keep you safe, keep them independent, keep them functioning. It doesn't matter the size, it's working with that area you have. So you can get, like I said, out of bed safely, and it's just making you able to reach your goals, like to get to the closet safely, and to, walk to the kitchen. And so space, it's keeping it clean, or just decluttered, or just to safety to get you from place to place, and activity to activity. So either independently or with a family member who can help you do that, or the caregivers who can help you do that.
How long typically are you there per session?
We average about 45 minutes. It depends if, how many rest periods they might need, or how many sessions they have during the day. Like sometimes, you have a physical therapist coming in, or a home health aide as well. But we average probably close to easy 45 minutes to an hour.
Then frequency during the week. So that's 45 minutes typically a visit. And how often during a week span would you?
I would say at least we average twice a week, pretty much, because like I say, there's physical therapy coming in, sometimes a speech therapist, a nurse coming in.
Yeah.
We really want to keep them, and then so the patient not getting too tired or overwhelmed, or the family, has time to digest all the information and then work with it as well.
Yeah, I'm assuming 2 times a week that the families are taking over the 5 other days too, to continue what you're teaching. What would be a typical home assignment?
I would say typically we do like light weights or TheraBand, if that's their goal, to get a little bit stronger and keep the circulation going.
Yeah.
We do some, lots of balancing, because that's a really important issue, because so many medications they might be on, and
All risks.
Yeah, we do endurance things, just standing, balancing, exercises. And if they need range of motion, like after a shoulder, a hip, or a knee, then we're making sure that we're following all those precautions, and then teaching them how to do it, so that the next time we come, or the next day, they'll be stronger and better and in less pain.
How do you assess that?
Yeah. Because on day one, like I said, we had a goal. So if goal is to stand for 10 minutes at the kitchen sink to do dishes, well, then maybe within the first week, they're able to do it for 5 minutes at a time. Or if they're able to, wanting to dress like their lower extremities, get their pants on or something. So maybe we can do that the first week, and then maybe week 2 or 3, they're able to reach down to get socks and shoes. So it's a kind of a step progression to get to each goal as they want. If it's range of motion, maybe they can only, bend their elbow or their shoulder 90 degrees. Well, then after the exercises in the program, we can get them up to maybe 120 degrees, or
Sure.
well, those, and we're always, checking that progress.
For example, I got a call this morning of a family member leaving the hospital and can't go upstairs anymore to shower. Now the main level is pretty much going to be where the care to be provided. How do you assess where you talk to the families that they can't go up the stairs anymore?
That would be another progress in that. I guess we would have them do on a daily basis, 2 or 3 times a day, up and down out of their chairs, standing. Maybe they have a walker, maybe standing with their walker, marching in place, doing some active reaching and stretching, so that 2 and 3 times a day, they're building up the endurance. So maybe by, day 1 and 2, they're only able to do those things for a few minutes. And then maybe day 3 and 4, they're able to do all those for at least 5 to 10 minutes. So then that way, when they do get to the stairway,
Yeah.
They will be able to go that longer distance. And then we also, we rearrange their, or get them some equipment they might need. If they need commodes or shower seats, so they can have them downstairs versus a bathroom upstairs or only the showers upstairs, we would help them get all those equipment needs as well.
How do you report all this valuable information?
In our evaluation, we write everything's all in that evaluation. So then that gets all sent to the doctors. And then there's conference calls between me, the nurse, the physical therapist, the home health aide, and then the nurse can get all that information together and make one phone call to the doctor so that the doctor will know how this person's doing ADL wise, or with the physical therapist, how they're doing walking, and home health aide, are they getting their weekly showers? So then she can relay all that information to the doctor, or we can call too. Many times, like the orthopedic doctors, they want to know exactly the range of motion their patients are getting and the services. So we can report directly to them, and that's what they want too. So there's the conference calls and the notes that we send out pretty regularly.
Mm-hmm. Before receiving our care for therapy, what would be typically in your mind like a good candidate for OT in your mind?
Well, like I said, we have many different people who fall are so they can learn safe techniques in the home. People who are short of breath, like with congestive heart failure or COPD, we can show them endurance and strengthening techniques so they can better body posture, better breathing techniques, so they can do their everyday activities safely, and that they don't have to rely on the caregiver anymore to get their clothes out of the closet or to make them a light meal. They can start doing those kind of things safely and with better posture, breathing, independence. So all those kind of medication changes too that people go on really change their function as well.
Yeah. Again, like if someone was watching this video, I know that you possibly answered this before, but if it was your loved one or someone that you were to care for, who would benefit from occupational therapy again? And what would be the best advice to get started?
Oh, definitely talk with your doctor and tell them what issues you're having. Are you, what changes have happened recently in your life or with your new diagnosis? Is there a new problem? Are you restricted in any way, like with range of motion or pain or weakness, change of medications? So the doctor just needs to know exactly the changes that have happened in your home that make you more dependent on your caregiver, that make you less safe, so that then they can write that and they can call Affinity and we can get the doctor's order that way. So the doctor is like the link. If that family member or a patient can just tell the doctor what has changed and what are your goals. I mean, I don't want to be sitting in this wheelchair for so long. And
It's wanted to ask if they reached their goals and then they ended care, but then something else happened again. Can they have your services again?
Oh, yeah. New hospitalizations, new diagnoses, or just, a change in your current diagnosis, then that can get you another prescription from the doctor for sure for therapy or home care.
Yep.
Yeah.
Again, just contact your doctor, communicate with them. And Deb, from the bottom of our heart at Affinity, you are family to us. You've been with us from the beginning. We appreciate everything that you do on the field for us. And thank you so much for chatting with us and sharing your expertise. And stay well. And thank you again for being part of the Affinity family.
Thanks. My pleasure.